Effectiveness of reduced planning target volume margins, significantly decreased side effects even with a high dose of 81 gray, and improved outcomes for prostate cancer patients. Those are the key findings in a recent study assessing the impact of margin reduction, or AIM. The Calypso system was used for real-time objective patient setup and continuous tracking during external beam radiotherapy. The primary objective of the study was to measure the effect of reduced PTV margins in patients undergoing high-dose, intensity-modulated radiotherapy. The assessment tool used was the EPIC Quality of Life Index. In the next few minutes, Drs. Howard Sandler and David Kahn will describe the AIM study results, the effect real-time tracking has on their treatment plans, and most importantly, the improved outcomes available to prostate cancer radiation therapy patients.
The AIM study, AIM standing for Assessing the Impact of Margin Reduction, was a clinical trial designed to see if we could observe a clinical benefit in patients by reducing the margin that we apply to the prostate to account for prostate motion. The importance of using the EPIC questionnaire in the AIM study is that the EPIC questionnaire is well validated and highly regarded among the prostate cancer community.
The most significant finding of the AIM study is that rectal morbidity was substantially reduced in patients who are receiving IMRT for the treatment of prostate cancer. When compared to the SANDA cohort, our patients received 81 grade. Our patients had larger treatment volumes, which you would expect to have greater urinary as well as rectal morbidity, but paradoxically, our patients have fewer side effects. So it really demonstrates to me that when we can reduce our margins, we're going to decrease acute morbidity, and hopefully this will translate into a decrease in chronic morbidity.
Without any tracking at all, I used to use a 10 millimeter margin. With gold fiducials, I use a 5 millimeter margin. With Calypso, I use a 3 millimeter margin, and we've shown in the AIM study that that results in an improvement in patient-reported quality of life.
Many of our patients can basically go through treatment and not have any side effects. And one thing that I've noticed and that my urologists have noticed is that patients are getting 45 treatments, 9 weeks of treatments, and they have almost no morbidity associated with the treatment.
Other findings that we observed in the AIM study was that there was no worsening of urinary side effects compared to the SANDA trial, despite the fact that in the AIM study, patients were treated to a nominally higher dose to the prostate.
You know, the original study design for the AIM study was for 300 patients. The interim analysis was so dramatic that they closed the trial early because they had enough patients to satisfy their statistical needs.
The AIM study used a typical group of prostate cancer patients. These are the average prostate cancer patient walking into radiation oncology offices throughout the U.S. It's very likely that these results are generalizable to the prostate cancer patient population as a whole. You can use ultrasound, you can use cone beam CT, you can use implanted gold fiducial markers, you can use the beacon transponders. Of all the technologies that are available, there's only one that can do tracking as well as localization. And the Calypso tracking technology is really what separates that localization modality from the others. In my opinion, it really provides an important advantage in terms of our ability to have confidence that throughout a course of radiation therapy, not just before each treatment, but during all of the treatments, that we know that the beam is on the prostate.
For more information about the AIM study, please contact a Calypso representative. Accurate, precise, real-time tracking. Hit the target, not what's next to it. Calypso.